patients who are on opioid medication are certainly at risk for increased risk for mortality from both overdose and suicides, as we pointed out. And we know from our own data that often is at the beginning as somebody gets started on opioid medication. But what many people don't realize is that as opioid medication are being reduced and patients are being taken off opioid medication and there's a discontinuation, there is an increased risk, at least for several months thereafter. I think there's a lot of discussion of this link between opioid reductions and if it's not done well, if it's not done in a patient-centered approach, that it's actually associated with greater risk than possibly even leaving the patient on opioid medication. So I think a general recommendation now, and this is where the CDC issued their own clarification to their CDC opioid therapy guidelines, as well as an FDA safety alert or announcement earlier this year, that basically says, hey, patients who are being taken off opioid medication and discontinued, if it's done abruptly, if it's done too fast, that may result in harm. So what we have to do is we have to give providers also time to make those adjustments and help the patient to bring them on this journey of a gradual reduction of opioid medication. And it may take years, right? We have to be patient with that. But most importantly, we need to encourage the dialogue between providers and their patients that they find the best strategy for each and every patient.
And one of my favorite slides to show folks, I think to really help underscore this, is just, these concentric circles that show the people that are being considered to be taken off are ones you really are concerned about. They have comorbid psychiatric issues, substance use issues, comorbid medical conditions, and the idea that just taking away that little bit of opioid is going to fix the situation is really, I think, simplistic, and we really need to take a patient-centered approach and think about, okay, if this patient is at risk, how can I address all those other risk factors that are making me think about why I need to make some changes in this patient's opioid regime? So I think that's something that I'm really hoping that folks that attend our talk really walk away from, because again, the risk mitigation doesn't just stop just because a patient's on a short course of opioids. It doesn't just stop once opioids are discontinued. It should be continually thought about from the patient-centered perspective. What can we do to make this patient the most safe and address their holistic risk all the holistic factors that may contribute to that risk?
So the best opioid safety strategy is really better pain care. So I think that's very important, that we don't take opioids away in isolation without truly engaging the patient in more safer and really more effective pain care approach in the long run. At the same time, I think what every provider can do who has patients who is on opioid medication and are being tapered and maybe at one point reach a point where the opiates are being discontinued, is just be aware that this patient may need continued support, right? So keep the dialogue, right? Continue the communication. When you prescribe an opioid medication, typically you have a follow-up every month, because you need to renew the medication. So once that last opioid prescription is stopped, maintain that communication. Give the patient a chance to return in a month or 2 months and 3 months, at least for a time period, so you don't break this connection between you and your patient. And the patient, if there are any concerns, they have a chance to bring it up to you. And also, these are patients, for instance, where we should prescribe naloxone as a potential rescue medication or an opiate overdose. So just because the opiate medication was stopped doesn't mean that the patient may not be at risk for overdose. They may return using opioid medication again, maybe prescribed, maybe in illicit access. And at this point, after having been off, they actually have increased sensitivity. Their tolerance went down. And they may not realize how vulnerable they are in regard to an opiate overdose.